Hello, hello, hello. Okay, so let us begin with Nash therapeutic study streak for today, 27th of March, 2025. And so far, Dr. Nash, in his book, after the series of urinary remedies like terebinthina and cannabis sativa, he now discusses two important remedies which are benzoic acid and sarsaparilla. So let us go over these two remedies and see what he has given about both the important remedies and how we can see them in the clinical practice, and what are the key features that we should know that these remedies will present to us in the clinic. Whenever we study a remedy, from the student point of view, from the academic point of view, from the theoretical point of view, there is always a group of symptoms which you will never encounter in clinical practice, and vice versa. Whenever you see the patients in clinics and the symptoms that the patients exhibit, it is not given important or importance in academic point of view. And for benzoic acid, there is one characteristic symptom that overrides everything else in the entire remedy, and this will be there in all the complaints of the remedy. Whether the patient presents with a normal cold cough, quinsy, which means a long standing problem, tonsillitis, throat infection, it can be headache, it can be diarrhea, it can be dropsy, it can be heart trouble, it can be rheumatic troubles, the dark brown urine and urinous odor. Now, there is a characteristic thing about the investigations that we do nowadays, and all the investigations are very much centered around the allopathic point of view and the disease point of view. But if a homeopath knows how to identify from the investigations or customize a set of investigations which he would probably be more suitable with in finding the remedy therapeutically, it is going to be unbeatable. And I am collecting some data and I'm working on it. And if you are in touch, if you have followed homeosetu uh, on YouTube, Facebook, Instagram, Twitter, you will find that some work in this direction I have always conveyed in all of my videos, and you will get some information soon about how you can, you know, use the investigations from the homeopathic point of view, because a urine routine will partially guide you to a remedy, but another set of factors for urine, for example, over here he has mentioned, Dr. Nash has mentioned urinous odor. The relatives of the patient or the patient himself will tell you that the urine's odor is so bad it stinks for hours in the washroom. Same is for other set of remedies, but nitric acid, the urine is like horses. For Berberis and Calcarea carb, he gives another set of important, pointers. For Berberis, it is turbid with urine, and Calcarea carb, the deposit is white. Now, tell me if any investigation will give you the idea of turbid urine or deposit is white or smell is horse like or smell is urinous like. There you won't find. And that is where we need to reinvent and reimagine the literature of homeopathy, which the stalwarts have mentioned in the past 100 years ago, 200 years ago, with what is happening in the current age. You need to revolutionize it. And we are bringing up some data and some information very soon about how you can access that particular feature or that particular aspect of homeopathy. So for Berberis, Dr. Nash says it is turbid urine. For calcarea carb, it is white deposit. For benzoic acid, it is horrible and no deposit. Horrible smell, but no deposit. And if there are any sort of rheumatic troubles, it can be starting from uric acid depositions to arthritis or reactive arthritis, or inflammatory autoimmune problems, anything with the urinary troubles which he has mentioned. Think of berberis, think of benzoic acid very strongly. He also gives us an option to give a thought to lycopodium and lithium carb, but the concomitants should be able to decide. So he has given a set of remedies. In each of the remedies that he shares, he gives a comparison and differentiation in his book Leaders in Homeopathic Therapeutics, and it gives us an idea of what remedies to think of when the patient presents to us with some symptoms. Let's go further. And for benzoic acid, Dr. Nash tells that you can use this remedy very strongly in all cases of kidney calculi, provided the urinous odor of urine is there. So, whenever you have a patient of urinary trouble, you should give a thought and ask them about what is the odor of urine. We rely too much on investigations, but we rely less on the information which our stalwarts have given in the past. If you can reimagine that into the new age, your work will multiply manifold, and you will be able to cure more number of cases. So thank you, Dr. Chirag, for your valuable comments, and I think you have been attending and seeing a lot of my posts and videos. So I guess you must have an idea of the work and the the information that I am spreading with the help of this venture that I have chosen. So for benzoic acid, let's go further, and Dr. Nash gives us in the end that old men with prostate troubles and dribbling of urine, benzoic acid should be thought of. And the dribbling of urine is there even after the urine has been cleared by the patient, but he comes to you and the urine in the clothing scents the entire room. This is what he mentions. Next remedy, what Dr. Nash tells us in his book Leaders in Homeopathic Therapeutics, is sarsaparilla. Another remedy with excruciating neuralgia of the kidneys. So, by the first few lines of the remedy, whether in Boreg, whether in Allen, whether in Nash, whether in herring guiding symptoms, the first few lines of the particular section or the entire generalities part of the remedy should give you an idea of what the remedy can do. And even if you don't read the smaller symptoms inside, you should know what is the remedy doing in the patient. Excruciating neuralgia of the kidneys is mentioned for sarsaparilla. You have to imagine a patient who lands up in your clinic with a renal calculi and the pain is unbearable, left, right, center, he is moving in agony. You can think of berberis, you can think of sarsaparilla also. Dr. Herring has been mentioned by Dr. Nash for gravel with rheumatic symptoms. And same he mentions for Lyco where there is red sand with clear urine. So to identify red sand with clear urine, you will have to tell the patient to collect the urine in a container and send you a picture. Before sending it to the investigations, he should send you the picture of the bottle of urine that he has collected. Then you will be able to understand whether the urine is turbid, as we discussed few minutes ago for Berberis, or it turns white. If you see for calcarea carb, Dr. Nash has mentioned in the previous remedy benzoic acid, or it is red sand with clear urine in lycopodium, as he mentions over here. And for sarsaparilla, Dr. Nash tells us white sand with scanty, slimy, flaky urine is there in sarsaparilla. Going further, he tells that there is a characteristic symptom, just like in benzoic acid, there is a characteristic symptom of a urinous odor and dark brown urine. In sarsaparilla, the characteristic symptom is much pain at the conclusion of passing the urine. You have to understand this very intricately. Pain at the conclusion of passing urine almost unbearable. So whenever a kidney patient comes to you, kidney calculi, and you need to ask a set of questions, you can ask this: whether you have complaints before urine, during urine, or after urine. And if it is after urine, especially the last few drops, it is sarsaparilla. This is also there in Thuja. I have cured a lot of cases. And since it is a psychotic symptom, a typical psychotic symptom, you will see medorinum is also there in this particular symptom mentioned by Dr. Nash. Berberis and equisetum are another couple of remedies by him. And he says next important thing is there in the sarsaparilla, which is tenesmus. So what is tenesmus? A patient passes urine, comes back, again goes, passes urine, comes back, again has a feeling that he needs to pass urine, he goes, sometimes he may be able to pass, sometimes he may not be able to pass. And he, Dr. Nash tells us over here that pulsatilla also has a similar urinary trouble, but it is with the enlarged prostate. So if you are struggling with prostate cases, prostatomegaly, or patients who are bordering towards that pathology of prostate, especially an old fellow, think of the remedy pulsatilla alongside Sabal cellulata, conayam, etc. etc. It will give a good cushion to the patient for few months, and it will kind of create a shift in his symptoms and give you the only symptoms remaining for curing, whether you need to cure it with constitutional or some other intercurrent medicine. So next Dr. Nash mentions is natramure also having a similar symptom at the close of urination, but it is burning and cutting in the urethra and spasmodic contraction in abdomen. Now, there is a challenge for a homeopath to understand the symptoms mentioned in the prover's language and clinically in the vernacular language. And somehow we'll have to come up with something which gives us an idea of this understanding. And if you are in touch with the uh, you know Homeo Setu uh, profile and YouTube channel or Facebook, you will get an idea about it. Last but not the least, Dr. Nash gives you an idea of the marasmus of sarsaparilla, and then he goes on in comparing marasmus of sarsaparilla with the other set of four or five remedies. For sarsaparilla, neck and the skin hang in folds. For Lycopodium, Sanicula, and Natrum muriaticum, they emaciate first in the upper body and then in the lower part of the body. For Abrotenum, it is bottom first and then the upper part. And iodum will be generally very much thin, but there will be excess of appetite. And the last remedy that he mentions in sarsaparilla for marasmus is a remedy which looks like a mummy, a mummified body, which is argentum nitricum. Patient is not putting weight and looks like a mummified body, argentum nitricum. So sometimes these remedies will look similar in your clinic, so you will have to decide on the basis of physical generals and physical particulars. And if you get an idea about the mind, very surely some symptom which is present, not interpreting something else, then you can be sure that this remedy is going to hit the bullseye. So sarsaparilla, Dr. Nash ends with telling us that it is a good remedy for headache and bone pains, aggravated or ailments from suppressed gonorrhea, which was the scene when he gave a lot of, you know, when he saw a lot of such patients of suppressed gonorrhea. By now, in the last 100 years, this disease is not existing, but its traces are still remaining in various forms like warts, like the psychotic ailments, and that will continue to remain. Dr. Nash had given 200 potency, he recommends it to us. And last but not the least, he tells us that there are cracks on the sides of the fingers and the toes for which he prescribes sarsaparilla, and retraction of nipple like silica sarsaparilla can also be thought. So that's all from me right now from Homeo Setu. You can keep following and stay tuned for interesting learning and transforming your homeopathic practice in the year 2025, and wish you good luck.